Dr. Susan.
Isn't it way too early for you to come pick up your meds? Why are you here?
It's not me getting medicine, it's them. Them.
It's open. Come in.
Quickly.
Quickly, Dr. Susan.
Dr. Susan, please save us.
Save us.
Didn't I tell you not to bring people here casually?
They're all lung cancer patients. They know you have medicine. They begged me to bring them. I couldn't stop them.
I've already told you my meds don't have official approval. I can't sell them to the public.
Dr. Susan, please help us. It's not just me. It's dozens of lives. I don't believe you can just watch people like us dying, in pain, and do nothing.
Yes, please save us.
Save us.
You all.
You can go to a regular hospital to get medicine. Why do you insist on coming to me?
Cancer meds cost $30,000 a box at the hospital. We can't afford them. I've been sick for 3 years, and I've been on the real meds for 3 years. My house is gone. My family is ruined. I really can't afford it anymore. Please, just take it as doing a good deed. Save us.
Save us. Save us. Save us. You all.
You're forcing me!
A doctor should care like a parent. I don't believe you can just watch people like us die. I also have a family. For them, I'll kowtow to you. Please save us.
Save us.
Please save us.
I'm begging you here.
Please. If you don't agree, we'll stay kneeling here and die here on our knees. We'll just kneel here forever. We'll kneel here until we die.
Please save us. Please save us. Please have mercy on us. Please.
All right. I agree. Get up, everyone. Get up. Get up. Hurry, get up.
Susan agreed.
But we need some ground rules. First, my meds cost money. I'll sell them to you at the lowest price, $3,000 per bottle.
That's great. 3,000.
Second, you can't tell anyone I have this medicine. It's still illegal. If I get caught, I'll go to jail.
Yes.
Third, don't bring outsiders here without my permission.
I agree. I agree too. We all agree.
Good. Come get the medicine.
Good.
My medicine, hurry.
Don't push, line up. First, line up one by one. Everyone line up, line up. 1 bottle per person, $3,000 per bottle. Have your money ready.
Dr. Susan, can you give me a discount? I really can't afford it. This one bottle is $3,000. That's $36,000 a year.
That's right. Give us a discount. We'll remember your kindness for the rest of our lives.
Indeed.
I've already told you these meds don't fall from the sky. $3,000 is my cost. If you're not buying, next person.
Let's discuss it again.
Dr. Susan.
Didn't you just buy medicine? Did you finish it so quickly?
Not for me, it's for my friend. Come over here.
Didn't I say you can't just bring people here?
Dr. Susan, don't worry. He's a close friend. Absolutely trustworthy. I know what I'm doing isn't very reasonable, but he really needs 2 bottles. Right. It's special circumstances. Please help him.
He doesn't look like he's sick.
He's not buying the medicine for himself. It's for his mother. She's in the late stage. They can't afford the official medicine. She's dying. Please, help her.
$3,000 per bottle, $6,000 total.
Dr. Susan, thank you so much. But you might have to come with us first.
You might have to come with us first. We got a joint report saying you've been selling overpriced fake meds under the pretense of treating lung cancer. Please cooperate with our investigation.
So you knew about this, didn't you?
Dr. Susan, we're doing this for your own good. We don't want to watch you keep going down the wrong path. In the past year, how much ill-gotten money have you made by selling fake medicine? Don't you have any idea? You!
All participated in the complaint, right?
We didn't want this either, but your medicine is too expensive. $1 costs $3,000. That's $36,000 a year.
Exactly. You're selling it too expensively. We can't afford it at all. We gave you a chance before to lower the price, but you wouldn't listen. Aren't you ripping us off?
Don't blame us. We also had no choice. It's all because you're too selfish.
Is that so? Back then, when you were kneeling in my clinic begging me, you didn't say that.
That was an emergency. Do the math. How much blood money have you made? We asked you to lower the price for us, but you refused.
That's right. Anyway, what you're doing is illegal sales. Then our complaint against her is legal and justified.
$1 of fake medicine costs $3,000. This time, let's make this heartless merchant cough up every cent she made.
All right. Very well. I can go with you. At most, I'll just spend a few years in jail, but you all... Without my medicine, we'll all die. Without my medicine, you will die. Let's go.
Leon! Susan has already been arrested. What do we do now? My medicine is almost gone. If I don't have this medicine, I'll die.
Don't worry, I've already discussed it with Mr. Howard from HQ Pharmaceuticals. HQ Pharmaceuticals is huge and foreign-owned. Why would a company like that scam poor folks like us?
Exactly.
Susan is really too black-hearted. She earns so much money. Ask her to lower the price for us. But she refused.
Yeah, it's fake meds anyway. There's hardly any cost yet. She sells it to us so expensively.
Yeah, she's truly blinded by greed.
Serves her right. Serves her right. Yeah. Since Leon said so, then we can all rest assured, Leon. We're counting on you.
Yeah, only you can handle this.
You'd better confess honestly. How many people did you sell the fake meds to? How many bottles? And how much did you make?
I sold it to 128 people. In total, I sold 340 bottles. And made almost 4 million.
Over 4 million. This is a major case. How much profit did you make in total?
I didn't make a single cent.
That's impossible. You're still lying at a time like this.
I'm telling the truth. If you don't believe me, there's nothing I can do.
Take her to the detention center. I'll get to the bottom of this.
Yes.
You're Susan's landlord, right?
Yes, you are.
I'm a police officer. Susan has been arrested. We need your assistance with the case now.
All right, then follow me. I haven't seen her for almost 2 months.
When was the last time you saw her?
Over a month ago, I guess. She lives right here.
Susan lives here, are you sure?
I'm sure, absolutely 100%. She's lived here for a year.
How much is the rent per month?
500.
That cheap.
Cheap. Even so, Susan still owed me rent all the time. Now she still owes me 2 months' rent. You guys arrested her. I can't get my rent back.
Owes you rent? That's impossible.
Why not impossible? She's just a pauper.
Do you know what Susan does?
She's a medical student and runs a small clinic in River City.
Then do you know why we arrested her?
No.
She sold fake meds and made 4 million illegally.
That's impossible. She earned 4 million and still lives in my rundown place.
Maybe she did it on purpose. To cover her tracks.
Mr. Howard, I've already done as you instructed. Susan has been arrested. The police are looking for evidence. It'll be hard for her to get away with it this time.
Good. Well done. But now I need you to do one more thing for me. What is it? Take those patients to the detention center and make a big scene. The bigger the scene, the better. But Susan is already in. I don't think that's necessary anymore, is it? You don't understand. I want to completely ruin Susan's reputation and leave her with no way out. That way she'll come begging to me. All right. But Mr. Howard, Susan is already in. Our medicine won't last much longer. What about what you promised us last time? Don't worry. Our group is already developing a similar drug. By then, it will be cheaper than Susan's, so everyone can afford it.
Good, good. Thank you, Mr. Howard. If there's nothing else, I'll take my leave then.
What an utter fool. Susan, oh Susan, if you had cooperated with me earlier, everything would have been fine. But you just had to act all high and mighty. In the end, you were still betrayed by these fools. This medicine is truly a miracle drug. It can even cure advanced lung cancer. These fools actually think that $3,000 a bottle is too expensive. If I get the formula, I'd sell it for at least $30,000 a bottle. By then, I'll be rich.
Susan. Someone paid your bail. You're bailed out.
Who?
I don't know him. He didn't want to give his name. Your acting is very good.
What do you mean?
Even I almost was fooled by you. However, since you committed a crime, you must face the consequences of the law. I'll see you in court.
Pay back the money! Pay back the money!
Come out! Pay back the money! Pay back the money! Pay back the money! Susan!
Pay back the money! Pay back the money!
Pay back the money! Pay back the money! Pay back the money! They're here! Quick! Quick!
Pay back the money!
Pay back the money!
The reporters are here. Susan, give me back my life-saving money. That was my money for medical treatment. Give me back my life-saving money. I already have late-stage cancer. She also swindled away this last bit of money. Without this money, how am I supposed to live?
That was my life-saving money. She's a monster. She even swindled this little bit of money.
Sir, you just said Susan swindled away all your hard-earned savings. Can you tell us what exactly happened?
6 months ago, I was diagnosed with late-stage lung cancer. The hospital said there was no cure. I originally didn't want treatment. I wanted to save the money for my family.
But that beats Susan. She tricked me into buying fake medicine for $3,000 a box. That was my hard-earned money. I carried cement bags one after another for that money. It was the same for me. My money was all swindled by her.
I couldn't afford her medicine. I knelt and begged her to give me a discount. She told me to get lost.
Exactly.
Only now do I know that what she sold me was actually fake medicine. All the money I earned through hard work my entire life was swindled by her.
Return the money, return the money. Return the money.
Return the money! Return the money!
Return the money. Return our life savings. Return the money.
Dr. Susan! They're already all so miserable and you still want to cheat them out of their hard-earned money. Don't you have an ounce of conscience? Cheat! When they knelt in my clinic back then, they didn't have this attitude. If I felt guilty, it would only be for one reason. I'd be betraying myself.
Susan, give me back my hard-earned money. That was my life savings. How can you be so shameless?
I'm shameless, Leon. If it wasn't for you kneeling in the clinic, kowtowing and begging, I never would have sold you the medicine.
Susan, you scammed my pension. My monthly pension is only around $3,000. I spent it all on your medicine. Now I have no money left. How am I supposed to live you? How am I supposed to live you?
When you were lying on your sickbeds back then, you didn't say that. You said whether it was 30,000, 300,000, or 3 million, you would all get treatment. But now it's only 3,000 and you've lost everything. Are your lives that cheap? Fine. Don't you want your money back? All right. Just bring the medicine back and I'll return every single cent to you. You don't dare. It seems whether it's fake medicine or not, you know it yourselves. Fine, you say my medicine is fake. As long as you provide proof that after taking my medicine your health didn't improve, I'll let you sue me. No matter how much money, I'll compensate you.
Dr. Susan, we meet again.
So you're the one who bailed me out. Spit it out, don't waste my time.
Dr. Susan, you really don't have to be so prejudiced against me. After all, I wasn't the one who reported you. I know Leon and his people stabbed you in the back and framed you. Now the entire internet is slandering you. They don't know the truth, which is why you're being condemned by everyone. However, I have a way to restore your reputation, and also to make Leon and his group lose everything and be disgraced. All you need to do is join our HQ Pharmaceuticals. Whether Leon lives or dies will be up to you. Also, the same goes for everyone who wronged you. Just one word from you, and they can all go to jail.
How do we cooperate?
I'm willing to spend 10 million for your lung cancer formula. I'm also willing to hire you as our company's chief drug researcher with an annual salary of no less than 1 million. Dr. Susan, I'm very sincere. I even brought the contract.
I thought you were just stupid. Turns out you're stupid and rotten.
What do you mean?
Exactly what it sounds like. Figure it out yourself.
You better think carefully. If you don't cooperate with me, then Leon and his group will surely testify against you in court. By then, you'll be disgraced and lose everything. What awaits you is only a long prison sentence. Dr. Susan, I'm only offering this because you've saved so many patients. And to be honest, our group is already imitating your lung cancer drug. Even without your formula, we'll crack it soon. By then, not only will you not get a single penny, but you'll also go to jail. I'm doing this for your own good. That's why I came to discuss this with you today. Don't be ungrateful.
Since you're able to copy my drug anyway, why go through all that trouble setting people up to smear me and buying my medicine? Do you have any idea how much a brand new anti-cancer drug is worth on the market? At least 5 billion. You offered 10 million to buy my prescription. Are you stupid or am I? Moreover, for the sake of my prescription, you incited those patients to complain about me disregarding their lives. Someone like you is not fit to practice medicine at all. You truly sicken me.
Death is at your doorstep, yet you're still putting on a brave front. When the time comes, I'll make you beg on your knees.
Let's quickly get our money back.
We must get it back. Why is it so crowded?
It's us who suffered.
Right.
The car's here.
She's here.
It's her.
Go!
Go, go!
Back off! Susan, give me back my hard-earned money!
Heartless, unscrupulous doctor, you ruined me!
Give me back my life, you murderer! Murderer! Give us our money back, murderer scammer!
Susan, you've sold so much illicit medicine and made so much ill-gotten money, they are now going to accuse you in court. Do you have anything to say? At most, I'll spend a few years in jail. But then, without my medicine, won't even survive. When the time comes, they'll all be begging me on their knees.
What are you talking about? What do you mean we won't survive without you?
Is she threatening us now?
Exactly!
So selling fake medicine is justified now.
Susan, the plaintiffs accuse you of selling fake meds at $3,000 per bottle, a total of 1,340 bottles, adding up to $4 million. Do you admit to this?
Yes, I do. Yes, I do. I did sell these medicines.
So she really is that kind of person.
The price was indeed $3,000.
What, Susan is already pleading guilty? Just now, outside the courthouse, wasn't she quite arrogant?
She's already pleaded guilty directly, so are they even fighting this case or not?
She just pleaded guilty directly like that fool. Absolutely foolish. No wonder she was harmed to this extent.
Your Honor, I need to make something clear. I said I sold these medicines, but I didn't say that I sold fake medicine.
This is simply ridiculous. A lung cancer drug. Even the government and top international pharma companies have poured billions into research and still couldn't make one. You, a med school undergrad, a doctor from a small clinic, you claim you developed it.
Officer, you're right. Our HQ Pharmaceuticals spent over 10 years and more than $1 billion and still haven't made that drug. Yet she, a small doctor from a small clinic, actually claims that what she sold wasn't fake medicine.
And since you say it's not fake, let me ask you, does your medicine have market approval? Does it have safety tests? Does it have a sales license?
I'm sorry. All those things you mentioned, I don't have any of them. Only big pharma companies can apply for these qualifications. A doctor from a small clinic like me cannot obtain them.
All right.
You say you want to save more people, then why don't you just sell your prescription to a large pharma company? Their production and sales power is way beyond yours. This way you could save even more people.
If I sold the formula to a large pharma company, they wouldn't sell it for just $3,000. They would sell it for at least $30,000. This goes against my original intention for developing this medicine.
How do you know they'll definitely sell it for such a high price?
Those big pharma companies, they're all capitalist bloodsuckers. They'd love to drain the last drop of blood from patients. Just look around the market. Are there any cheap anti-cancer drugs?
Only by making a profit can companies be responsible for these patients. You clearly have a huge bias against big pharma. Then let me ask you, sold $4 million worth of drugs. How much illegal profit did you make?
I didn't earn a cent.
Impossible.
No one's gonna believe that you sold $4 million worth of medicine and didn't earn a single penny. Do you think any of us would believe that?
Exactly. Yeah. I don't believe it. How is this possible? Who does business without making a profit? Fraud.
The entire R&D cost for this box of medicine is $2,900. The remaining money isn't even enough to pay my rent.
Do you think I don't understand pharma so you can just fool me? Well, you're wrong. I brought some help today, Your Honor. I'd like to call Professor Edward from the medical university. Professor Edward, I'd like you to take a look at this prescription.
This is actually... Oh my goodness. In my lifetime, I can actually see such a treasure. I can die without regrets. Yep. A peerless treasure.
Professor Edward, are you all right? Take care of yourself. Is this prescription really effective?
Officer Neal, could you tell me who made this prescription? Could you take me to meet her? I'll even kneel for you.
Professor Edward, please explain what exactly is going on.
This prescription is divine. You don't know? This prescription is a long-lost ancient formula. I've only seen it in ancient texts. It's extremely rare. I guarantee with my life that this prescription is worth at least $2 billion.
What But Susan's formula is actually the long-lost ancient great Shia prescription.
Susan's prescription actually works. Even if it just slows the disease, that's still an incredibly powerful effect. Exactly.
Impossible. Hers is definitely fake. So many pharmaceutical giants like us couldn't develop this medicine. How could a doctor from a small clinic like her possibly develop it?
Sir, are you questioning my judgment?
I'm not questioning your judgment. It's just that it only proves that what she has is indeed an ancient great Shia prescription. But there's no way to prove that her ancient prescription is definitely effective. I know you studies traditional medicine, but we in Western medicine care about data and experiments.
That's right, Susan. Although your prescription is an ancient great Shia prescription, it doesn't prove that your medicine is effective. Do you have anything else to say?
If you want to prove the effectiveness of my medicine, it's simple. These plaintiffs on stage are all my patients. They all had lung cancer, but they are all alive and well. They've lived until today.
Even if they are all alive, it still doesn't prove that your medicine is effective. Perhaps it's their strong vitality. In short, your medicine has no approval, review, or certification, so it's fake medicine.
All right. Then I'll show you the evidence.
What is this?
These are the medical records of all plaintiffs present. They document their conditions before starting medication, and then each course of treatment's physical changes. From these medical records, we can see that after they started taking the medicine, their conditions all improved. Judge, please have someone verify this.
Edward, please take a look at this medical data. Is it authentic and valid? Judge, that's right. Every patient's improvement is the effect of this medicine.
What? This lawsuit. What do you think her chances of winning are? How high are they?
If this were abroad with this kind of evidence, I could achieve a 100% win rate. Not only could we win the lawsuit, but we could also send them all to jail. But this is Great Xia. The national conditions are different. I can't guarantee it, but currently there's at least a 90% chance of winning.
HQ Pharmaceuticals is currently counterfeiting their medicine. If at this time we acquire their formula, do we have the confidence before HQ Pharmaceuticals to register the complete global patent?
It should be fine. Our technology is better than HQ Group's, and we also have a more complete pharmaceutical industry chain. More importantly, if we can get Susan's complete clinical trial data, then we will definitely be faster than HQ Group.
All right. Since that's the case, we'll pay a hefty sum to acquire her formula. Get ready.
Yes.
We'll see you back in the country, Susan.
The mortality rate for advanced lung cancer is 95%, but not a single patient who took my medicine has passed away.
This
Is the best evidence. In other words, the fact that they are alive today sitting here as plaintiffs suing me is all because they took my medicine. This must be the story of the farmer and the viper. I saved them. Yet they dragged me to court.
This is too ironic. The classic case of biting the hand that feeds you.
If everything Susan says is true, then these people are truly detestable.
Susan, this is just your side of the story. If your medicine was truly effective, then why would they still take you to court?
Well said. I have a piece of evidence here that can prove all the plaintiffs present have ties with HQ Pharmaceuticals. HQ Pharmaceuticals has transferred money to the plaintiffs multiple times. HQ Pharmaceuticals has always wanted to buy my formula. May I ask if HQ Pharmaceuticals and the plaintiffs have any financial dealings? Are the plaintiffs involved in financial transactions with HQ Pharmaceuticals?
That's not true. I object to Susan's statement. I saw how pitiful they were. That's why I gave them financial assistance. This has nothing to do with the case.
Oh? Then why did you only help the plaintiffs present here and not all patients? Is all of this just a coincidence?
Why are you all looking at me? I didn't take any money. I didn't take money.
I'm innocent too. I didn't take any money either.
I did take money, but that was donated for my medical treatment, Your Honor.
I didn't take money. I didn't take money. I'm innocent. I didn't take money.
Silence, I now declare. This case concluded. The verdict is as follows. Susan illegally sold drugs not approved by the state. The clinic is ordered to suspend operations for rectification and its business license is revoked. A fine of $50,000 is imposed. However, considering its proven efficacy, this court will not impose further penalties. Susan is released immediately.
Released just like that. What about our money then?
They're letting her go.
What? Don't let her leave. She can't leave.
Don't think that just because you won, you're in the clear. I'll make sure the prescription you hold becomes worthless. We'll see if you can still smile then.
Excuse me, Ms. Susan, regarding this trial, do you have any thoughts? No particular thought. I can only say justice resides in people's hearts. Some people will not succeed.
Ms. Susan, will you continue to sell medicine to patients? The special medicine you have can cure lung cancer. It's a medicine that benefits countless patients. Please tell us, will you continue to sell it?
Sell. I will definitely continue selling. It's just that I won't sell fake medicine anymore. I will establish my own company and obtain policy approval. By then I can benefit more people. But before that, I won't sell a single box of medicine. Susan saved your lives. Why on earth did you do this?
You know that what you did almost sent Susan to jail and indirectly caused the deaths of many other lung cancer patients? Now Susan has been acquitted. Don't you have anything to say?
It wasn't me. It was.
It was.
Them who did it, they all did it.
What? You were the one who said at the beginning that as long as we successfully sued, Susan HQ Pharmaceuticals would give us cheap medicine.
Exactly.
What? Mr. Howard, Mr. Howard.
Mr. Howard.
How could this happen, Mr. Howard? All of this is HQ Pharmaceuticals' conspiracy. Mr. Howard, may I ask, is what they're saying true? Was it all your scheme? What exactly is your motive?
This is all nonsense, pure slander. Suing Susan was their own choice.
Oh, Mr. Howard!
Mr. Howard.
How could you do this?
Leon! What exactly is going on? Didn't you say if we listened to you, HQ Pharmaceuticals would give us medicine?
Let's talk this over.
Just talk to her nicely. How can she not give us...
Didn't the lawsuit already finish? Why are you still here?
Dr. Susan, I'm almost out of my medicine. Can you sell me one bottle first? Just one bottle.
Dr. Susan, please save me. I'm running out of my medicine, too. You wouldn't just watch me die, would you save us?
Dr. Susan, please sell me the medicine. I really can't live without your medicine.
I didn't want to sue you either. We were forced. Howard forced us. Please, just sell us one bottle.
Just now in court, didn't you say my medicine was fake?
It's not fake medicine. It's not fake medicine.
How could your medicine be fake? We've been taking it for a year.
If it's fake medicine,
Wouldn't we know?
I remember you said my medicine sold for $3,000 per bottle. It's too expensive.
Not expensive, not expensive. Dr. Susan, here's $3,000. Please take it.
I have 6,000 here. I'll buy 2 bottles of medicine. I haven't taken my medicine today. Please give me the medicine first.
Dr. Susan, You're a good person. You'll definitely save us, won't you?
Dr. Susan, please save us.
Oh, right. I happen to have a bottle of medicine here.
Sell it to me first.
Sell it to me, sell it to me, sell it to me. My illness is more severe.
However, even though I have medicine, I won't sell it to anyone.
Throw the medicine! Why did you pour it out?
My medicine. My medicine.
How can you spill the medicine on the ground?
My medicine! What are you doing? Why did you do that?
This is my medicine. This is my life-saving medicine.
Susan, what are you doing? Why did you destroy our medicine? This is our life-saving medicine. Why exactly did you do this?
First, this medicine is mine. I can deal with it however I want. That's my freedom. Second, didn't you say my medicine was fake? Now that I've destroyed the fake medicine, isn't that exactly what you wished for?
Susan, we're all terminally ill. Why can't you save us?
It's not that I don't want to help you. It's just that my medicine is fake. If I sell you fake medicine, you'll just sue me again. What am I supposed to do?
Susan, she won't save you. I will. If she won't save you, I will. As a professional in the medical field, I would never stand by and watch you suffer. Our company, HQ Pharmaceuticals, has successfully developed a special medicine for lung cancer. It will be on the market soon. I believe every patient will benefit from it. I hope everyone can come and attend my new product launch then. And our product is definitely better than her reputation-seeking fake medicine. But HQ Group has already researched the new medicine. It's coming to market soon.
We're saved.
We're saved. That's great. Exactly.
Howard, you promised us before that you would sell us cheap medicine. You can't go back on your word.
Of course I remember, however, but that will have to wait until the new product is launched.
Whose motorcade is this all-luxury cars? Whose motorcade is so powerful?
This seems to be Ark Pharmaceuticals' motorcade.
Ark Pharmaceuticals. That's the world's largest pharmaceutical company. What are they doing here? Could it be that they want to cooperate with HQ?
My chance has finally come.
Look, Xavier, president of Ark Pharmaceuticals.
Mr. Xavier, hello, I'm I.
Miss Susan, it's a pleasure to meet you. We really hope to cooperate with you. Let's talk in private.
Mr. Xavier, did you mistake me for someone else? I am the chairman of HQ Pharmaceuticals. Our latest research on lung cancer medicine is something we'd be very willing to cooperate with your company on.
Excuse me, I don't know you and I don't want to cooperate with you. I came here this time to see Miss Susan.
Mr. Xavier, you might not know this. Our company has already developed a lung cancer drug. What she has is just a piece of waste paper now. Don't let her fool you. What she has now is just a piece of waste paper. Don't let her fool you.
Bodyguard,
No, Mr. Xavier, don't let her fool you.
drag him out. I don't want to see him.
Mr. Xavier, if you want to develop this lung cancer drug, then you can only cooperate with our company. Mr. Xavier! Mr. Xavier!
How could he be dragged out?
Mr. Xavier, actually, I think what he said isn't entirely unreasonable. After all, he has such a big pharmaceutical factory while I'm just one person.
I only trust Ms. Susan alone.
All right. So what is your purpose for coming today?
Then I'll be direct. Our Ark Pharmaceuticals is willing to offer $1 billion to buy your prescription.
Oh my goodness, $1 billion! That would take Susan 10 lifetimes to earn.
I'm sorry. I refuse.
What did you say?
If this is the most you can offer, then I think we have nothing more to discuss.
Ms. Susan, you should know HQ Pharmaceuticals is replicating your drug. If their generic drug comes out early, your drug will be worthless.
HQ Pharmaceuticals is indeed replicating my drug. But first, let's not talk about whether they can successfully replicate it. The fact that you came to me shows you are confident in succeeding before them. And that's with the support of my experimental data. Even if HQ Pharmaceuticals managed to replicate my formula, they could only sell it domestically. With Ark Pharmaceuticals' global reach, the value of my formula goes well beyond $1 billion. Besides, I am absolutely certain HQ Pharmaceuticals cannot successfully replicate it at all.
Your analysis is quite sharp, Miss Susan. In that case, I assume you already have a price in mind for this drug formula. Why not share it with us?
I want $5 billion. Plus one of your pharmaceutical R&D centers in River City.
Impossible. We can negotiate on other terms, but the R&D center is out of the question. We invested $5 billion in 3 years into building it. It's one of our 3 flagship facilities in Great Shia. With the $5 billion in cash, added your formula would cost a staggering $10 billion. That's simply beyond our capacity.
Then there's nothing left for us to discuss. You may leave.
What? Susan actually turned down Ark Pharmaceuticals' $1 billion offer. Am I hearing this right?
And she even had the audacity to ask for $10 billion on top of that. She must be out of her mind.
I'm very interested to know, given this outrageous demand, why you are so confident that we would agree. Could you tell me what makes you so sure?
Because this drug I've developed is a groundbreaking and unique therapy capable of treating late-stage lung cancer. If successfully launched, it would bring Ark Pharmaceuticals at least $20 billion in profits. It would also boost your stock value to become the world's first trillion-unit pharmaceutical giant.
I have to admit, your reasoning is compelling. You have a deal.
What? Ark Pharmaceuticals actually agreed to Susan's astronomical demand.
Seriously? That's worth $10 billion. Susan's going to land herself on Sea City's rich list.
Exactly. However, I have one more condition.
What condition? Tell me.
You have a partnership with HQ Pharmaceuticals, right?
Yes, their core business is distributing our products.
I hope that your company will sever all ties with HQ Pharmaceuticals.
No problem, it's a small matter. But I have a request.
Which is go on.
May I have dinner with you?
Oh my god, the CEO of the world's top pharmaceutical company just asked Susan out to dinner.
Could it be that he exactly
Has feelings for Susan, really?
It's hard to say.
After all, Susan just secured a 10 billion unit deal. She's the pharmaceutical industry's brightest rising star.
No way.
But she actually turned him down.
The CEO of the world's top pharmaceutical company got his dinner invitation rejected. That alone is front page headline material tomorrow.
May I ask why?
Because I've just come out of a court case, I'm flat broke now. I still owe a $50,000 fine. I really don't have money to treat you to dinner.
But didn't you just get $5 billion for the formula?
Well, that payment hasn't cleared yet. All I have on me is a few hundred. If you really want me to treat you to dinner, we can only eat at a street food store.
A street food stall? What's that?
It's a place that's cheap, delicious, and you won't find it abroad.
All right. Then we'll eat at a street food stall.
But now we might not be able to go. The reporters outside seem eager to ask you something.
Hello, Mr. Xavier. We have a few questions for you.
Okay, what would you like to know? Go ahead and ask.
Mr. Xavier, could you tell us why you paid such an exceptionally high price for Dr. Susan's formula?
As Ms. Susan herself explained, this drug has the potential to change the world. So I believe that alone justifies its value. Moreover, Ms. Susan's original purpose in developing it was to save lives and alleviate suffering. Therefore, I believe its worth transcends mere monetary measure.
Mr. Xavier, now that Ark Pharmaceuticals has acquired Ms. Susan's formula, have you considered the pricing strategy? As you know, Ms. Susan originally sold this drug at a price of $3,000 per bottle. I wonder
How Ark Pharmaceuticals will price it.
The pricing for this drug has not been decided yet. It will be determined by our investment production, sales, and other costs. Furthermore, as a commercial entity and a publicly traded company, our primary responsibility is to the returns of our shareholders. Therefore, the final price will not be $3,000.
There it is. From Xavier's words, it's obvious their price will be significantly higher than Susan's.
Businessmen are all profit-driven. Given the same product, whoever charges more gets the deal.
Ms. Susan, could you please suggest to Ark Pharmaceuticals not to set the price so high? If it becomes an unaffordable drug, many families simply won't be able to cover the cost.
You're worrying too much. It's not my decision to make. Besides, Ark Pharmaceuticals developed it definitely for profit. Moreover, when I sold it at a low price before no one appreciated it, they even took me to court. It's not even my drug anymore. Why should I stick my neck out now? All right. I've said all I'm going to say today. Now I'm going to have dinner with Mr. Xavier.
You.
what should we do?
Right, please help us, please help us. Help me, please help us, please. We depend on you.
How is it? Is it delicious?
This is a street food stall.
Here, try this one too.
What is this?
This is our Great Shia's best liquor.
Great Sia's best liquor? I thought that was Mautai.
Mr. Xavier, you've been abroad, so you might not know. For us true Great Shia locals, this is the good stuff. Here, let me fill it up for you. How is it? Does it taste good?
Unlike Mautai, this one has a lingering finish.
Glad you like it.
Actually, there's something I'd like to ask you.
Go ahead.
Since we've already exclusively acquired your formula, what do you need the R&D center for?
Because I still have other drugs to make to research, develop, and sell. It's just that this time I won't sell without authorization. I will wait for full national approval before any launch.
You have other new drugs.
Yes.
Developing a new anti-cancer drug is very difficult. Even in M country, to develop a type of targeted anti-cancer drug requires at least $5 billion in investment. This process involves target identification model establishment, lead compound discovery, and lead compound optimization, followed by molecular screening, structural optimization, pharmacological evaluation, safety assessment, and so on. This demands a team of at least 500 people on a timeline exceeding a decade. You're just one person. You have none of that.
You're applying Western frameworks to approach anti-cancer drug development. But let me remind you, you must understand that Great Xia has 5,000 years of history. Our ancient formulas existed 2 millennia before Western medicine was conceived.
Great Xia's ancient formulas.
Exactly. Long before modern Western medicine took shape, Great Xia's ancient formulas were already healing the sick and saving lives. Moreover, many ancient formulas have truly miraculous power to bring people back to life.
So what's your next drug?
I can't reveal that yet. It must remain a secret. All I can say is that it will be even more revolutionary enough to shake the entire world.
You truly are a mystery. I'm becoming more and more interested in you.
Then you'd better be careful. Don't go falling for me. The efficiency of a multinational company is truly impressive. $5 billion has cleared already. I'm about to become a real boss.
So what do you plan to do next?
Next, I'll take full possession of the R&D center and the office complex and begin my new drug development.
Then I wish you swift and total success.
Professor Zane, what's the status of our lung cancer drug? Any progress?
Mr. Howard, as for the sample you provided, we've identified its raw material components. But the synthesis process,
But what?
We've already tried countless herbal processing combinations. However, we still can't replicate the therapeutic effect.
Useless! We have a lab of 100 people. Even with the formula in hand, you're telling me you can't copy Susan's drug.
Mr. Howard, the efficacy of traditional Chinese medicine is greatly related to the processing technique. The same herb, if processed differently, will have completely different effects.
I don't care. How soon can you get it done?
Well, at least a few more months.
Unacceptable. A few months is too long, I've already bragged about it. If we don't launch it soon, it'll ruin the reputation of HQ Pharmaceuticals.
Actually, we do have one combination that shows some effect. It has some efficacy in inhibiting cancer cells. However,
what? Out with it!
However, there might be minor adverse effects. Human trials would be required for confirmation.
How long will human trials take?
Human trials are quite complex. The approval process is one thing, but finding suitable subjects is another matter entirely.
Don't worry about the test subjects, I have that covered. You just focus on speeding up production. That should move things along, right?
Then it's manageable.
My coughing's gotten much worse lately. I feel weak all over. All the time I almost couldn't even walk.
Me too, I even coughed up blood 2 days ago. What are we supposed to do?
Last night I could hardly catch my breath and almost blacked out.
If I'd known it'd come to this, we should have just stuck with Susan's drug. It's expensive, but our lives were worth more.
Leon, didn't you say HQ Pharmaceuticals would give us cheaper drugs? Why is there still no sign of it? They wouldn't go back on their word, would they? It's all your fault. If you hadn't talked us into it, we never would have sued Susan.
Well, they shouldn't. A company like HQ Pharmaceuticals certainly won't go back on their word.
Look, it's a call from HQ Pharmaceuticals. It's them. Hello? Is it true, Mr. Howard?
Okay,
I'll bring everyone right over.
what did they say?
Stop worrying. HQ Pharmaceuticals has already developed the miracle drug. We're going to get it now, and it's even free.
What, we have the drug? And it's free. Yes, it is.
You're not joking, I must be dreaming, right?
Of course it's true. A giant like that wouldn't scam us. Let's go now. Come on, everybody, let's go.
We're here to get our medicine. How are we supposed to get it in the meeting room? Exactly.
Is getting medicine really that complicated? Just let us come and get it. It's that simple.
Everyone, please quiet down first. Mr. Howard made the arrangements. He must have his reasons. Don't worry, everyone.
Everyone's here.
Mr. Howard.
Okay, first of all, I'd like to thank you all for coming. HQ Pharmaceuticals is a big enterprise in River City. Of course, we bear the responsibilities of a large enterprise and its commitment. I understand the difficulties you all are facing. Therefore, I specifically applied for a free drug trial opportunity for everyone. However, before the trial, you all need to sign this experimental agreement in front of you.
Experimental agreement. Why do we still need an experiment?
Sign it.
Hasn't it already been successfully developed?
This medicine couldn't possibly have any other risks, could it?
Everyone, I know you have doubts, but what you might not know is that for a drug from research and development to market launch, it must go through an experimental phase. But this is just a formality. Our drug is a copied version of Susan's drug. It's absolutely safe and effective. Rest assured, everyone.
I'm willing to trust HQ Pharmaceuticals. HQ Pharmaceuticals is such a big company. How could they deceive us? Then I believe it too.
I believe it too. Thank you for providing us with free medicine.
I trust them.
Then everyone, please sign quickly.
The HQ Pharmaceuticals is truly a conscientious enterprise. They actually give us free drug to take. This will save us $3,000 in the future.
Finally, I won't have to deal with my daughter-in-law's disdain anymore.
Yes. But Susan used to be so heartless. This bottle of drug, how dare she sell it for $3,000? She must have made a fortune in the past 2 years. Huh?
In a couple of days, when I'm better, I can even go out and find a job and support myself.
Come on, you're really thinking big, aren't you? In 2 years, I'll go apply to be a short drama actor.
Here they come.
Ms. Susan, may I ask why you decided to rename your pharmaceutical company to Hope Pharmaceuticals?
Because I hope my drug can bring hope to more patients.
Ms. Susan, what is the focus of your new drug, and what stage of research is it in?
I'm sorry, I cannot disclose that now.
Ms. Susan, HQ Pharmaceuticals has announced that they have successfully developed a miracle drug for treating lung cancer, and they have already found patients to participate in clinical trials. They are the very people who reported you earlier. What are your thoughts on this?
You're broadcasting live, right? Then I'll take this opportunity to give them a warning. If HQ Pharmaceuticals' drug is developed by imitating my drug, then I hope they should not participate in the clinical trials. Their imitation drug does not have the complete formula. The ingredients are extremely unstable. It could very likely cause severe complications and even be life-threatening.
This is pure nonsense. Our new lung cancer drug is the result of our lab's many years of research. There's no such thing as imitating Susan's drug. This is utter rubbish. Her drug is fake. How can it be compared to our miracle drug at all?
Mr. Howard, Susan says your medicine has safety concerns and urges everyone not to participate in your drug trials. What's your take on this?
That's right. She said the ingredients in your new drug pose a hidden danger, so the drug could trigger complications and even be life-threatening. How do you respond to her?
This is simply utter nonsense. For every single word Susan has uttered, our lawyers have already documented and preserved the evidence. If she continues to slander our HQ Pharmaceuticals, then we will definitely sue her and make sure she goes to jail.
So, about your new drug, does it pose any safety risks?
Our new drug is extremely safe with not a single hidden danger. Moreover, there is absolutely no risk of causing complications. Look, these patients are all vibrant and healthy standing right here before you. This is the most solid and compelling evidence. Exactly. We are among Mr. Howard's first batch of new drug trial participants. We absolutely trust Mr. Howard and HQ Pharmaceuticals' R&D capabilities.
Thank you, Mr. Howard, for giving us the opportunity to try the drug. It is he who gave us the will to live. If it weren't for his immense kindness, we would all be dead.
That's right. Mr. Howard is the true benefactor. Unlike Susan, she always deceives us. We believe Mr. Howard will provide affordable medicine to all of us.
Absolutely.
Stop! You stop right there!
Susan, I am legal representative from HQ Pharmaceuticals. You have repeatedly, in public, spread rumors and slandered against HQ Pharmaceuticals. This has caused HQ Pharmaceuticals severe economic losses and reputational damage. I now represent HQ Pharmaceuticals to formally issue you a lawyer's letter. A court summons will be delivered to you shortly, so prepare to face a lawsuit.
Susan, we've all been saved now. Don't you dare keep deceiving people.
HQ Pharmaceuticals' drug is the real miracle cure that saves lives. Stop slandering it.
If it weren't for HQ Pharmaceuticals, we would all die, Susan. Are you trying to destroy HQ Pharmaceuticals and kill all of us?
Susan, stop now. Stop deceiving us. We are all doing great now. And in the future, things will only get better.
If you have evidence, then go ahead and sue. I'll accept your lawyer's letter for now. I'll be waiting for you to sue me in court again. As for you people, if you don't want to die or die a horrible death, then stop taking HQ Pharmaceuticals' drug. If you continue to take it, the consequences will only get worse. This is your last chance.
Susan, for everything you just said, the reporters here have all recorded. Everyone here, including countless viewers online, are all witnesses. So prepare to face legal punishment.
Susan, stop talking nonsense. You just want to discredit the miracle drug. We won't believe you anymore. Our bodies are now getting better and better.
Auntie! What? She's spitting blood. Something's happened!
She fainted.
Does anyone know what's going on?
How could she faint?
Dr. Swan, you must have a way. You must have a way to save her. You're a doctor. She's your patient. You surely won't abandon her.
The second one.
What do you mean? Another one collapsed. What?
The third one.
What's wrong with all of them? What's happening? Why are they all collapsing?
The fourth one! Susan, quickly save them! They're already in shock. If you don't save them soon, they'll die.
Lawyer, aren't you going to sue me anymore?
I won't sue. Please save them quickly. They really will die. They're waking up.
They're really waking up. Dr. Susan is truly a miracle doctor.
They're moving. They're awake. Everyone's awake. They're moving.
How amazing.
Take them to the hospital quickly. They're not completely well yet. Don't take random medicine again.
What an idiot. Still trying to fight me. It's even better if you make a scene now. The more commotion you make, the more people will believe me. Even if the whole world knows my drug is fake, so what, I'll still make money just the same.
Mr. Howard, this is bad. Something terrible has happened. Something terrible has happened.
What happened so reckless?
Several patients who tested our medicine during a live broadcast by reporters suddenly fainted and went into shock.
What? How could this happen?
Probably.
Tell me quickly!
It's probably because they took our medicine.
You bunch of good-for-nothing freeloaders! Why didn't you say earlier if there was a problem? Now that something's gone wrong, you tell me now. Are you trying to kill me? We must distance ourselves from this matter. Now you quickly take the non-disclosure agreement and go find their families. Give them some money and make them keep quiet. No! Make them publicly state that their bodies were already sick and it has nothing to do with our drug.
Yes, sir.
Mom, it's okay. It'll be fine.
Excuse me. Are you Maris's daughter, Miss Lily?
That's me.
I'm from HQ Pharmaceuticals, the chairman's assistant. I have something to discuss with you.
Don't worry.
Miss Lily, Mr. Howard asked me to tell you that you need to clarify publicly that your mother's health already had issues, and our medicine has nothing to do with it.
What? How could you distance yourselves? This must be your drug that caused this problem.
Miss Lily, please don't get agitated, Mr. Howard said. As long as you cooperate, we are willing to give you $200,000. Even if later any health issues arise with your mother, we will still provide additional compensation. The amount is guaranteed to satisfy you. The money is on this card. The password is 660. Miss Lily.
How is your mother doing? Has she woken up? Are the results out, is it? As Susan said, a side effect of taking HQ Pharmaceuticals' special drug. Please don't make wild guesses. Susan's words have no basis.
My mother's situation is just an accident. She's already in this state. I hope you won't continue to report carelessly. Let's uncover the truth of the matter.
Whatever it takes, we absolutely cannot let the stock price fall. Invest all funds.
Yes. Mr. Howard, they have stopped shipping. We successfully stabilized the stock price.
Good. That's great.
This is bad, Mr. Howard. Suddenly, a big short seller is shorting. The shorting amount is 10 billion.
What?
What who is so powerful to spend so much money shorting our group?
I'm not quite sure about this either. Bad news, Mr. Howard. Our company's stock has plummeted. It has already dropped by 50%.
What? It's over. Everything is over. Everything is over.
Hello, your stock has been shorted. Your profit of 5 billion has been credited.
Mr. Howard,
The lab test results are already out.
what's going on? Tell me quickly.
The lab has already analyzed and found out that our new drug has very unstable ingredients. This will lead to complications for lung cancer patients, and currently, these patients' symptoms can basically be determined to be caused by our new drug.
What? Is there any way to improve it?
Well, it's difficult, unless
What? Tell me quickly.
there's someone willing to help.
Who?
Susan.
Susan.
She knows our new drug has a problem, so it's very likely she has a way to save those patients, and has a way to improve our new drug.
But how would Susan cooperate with us? We've already fallen out. A while ago, we even took her to court.
That's not necessarily true. In business, there are no permanent enemies, only permanent interests. As long as the price is high enough, I think no one is beyond buying off. Get the car ready quickly. I need to go to Ark Pharmaceuticals. This time, I want her to see my sincerity. Dr. Susan. Dr. Susan, this is a small token of my appreciation. Just a small token. It's nothing much.
I can't accept this gift.
Yes, you can. The miracle drug you developed has saved so many patients. Consider this as me giving it to you on their behalf.
It seems Mr. Howard's days are really tough. Otherwise, you wouldn't have prepared such a lavish gift to come see me. Did the drug have problems? Patients got hospitalized. Then you ran out of options, so you came to me.
Dr. Susan is straightforward. Indeed, a hero emerges from the young generation. I have indeed met some trouble, and I'd like to ask Dr. Susan to lend a small hand. But I absolutely won't let you help for nothing. I will give up a stake in HQ Pharmaceuticals, 10% of the shares. You should know, HQ Pharmaceuticals is worth hundreds of billions. Most importantly, if the problem of the miracle medicine is solved, its market value could soar to 200 billion. By then, your shares will be worth 20 billion.
Such a high price. I was indeed tempted.
Then, Dr. Susan, so you agree?
Agree? Agree my ass. Do you take me for a fool? The stock price of your HQ Pharmaceuticals in just one short hour plummeted by 50%. Now, it should only be 50 billion now, let alone whether it can recover. Even bankruptcy liquidation is uncertain. You're offering some completely worthless things and you expect me to risk my life for you. Do you think I'd agree?
Dr. Susan, what terms do you want? How much money do you want? You can name anything you want.
It seems Mr. Howard is truly scared. Scared those patients can't be saved.
Hey!
Then back then you shouldn't have come up with those bad ideas and had those people sue me. Now I'm fine, but you're in deep trouble instead. Tell me, isn't this just karma?
Dr. Susan, as long as you're willing to help me, I'll give you 30% of the shares. No, 50%. 51% of the shares. As long as you're willing to help me, from now on, HQ Pharmaceuticals, you'll be in charge, okay? Please help me, I beg you.
Only now do you remember to beg me. Too late. From the moment you first incited those people to report me, the two of us were already sworn enemies. You don't need to deny it, I believe. If you had the chance, you would definitely try to finish me off. By the way, let me remind you again. Today, the one who used 10 billion to short HQ Pharmaceuticals was me. Thank you for letting me earn 5 billion.
What? It was you who shorted HQ Pharmaceuticals. Why would you do this?
Why would I do this? Then back then, why did you do that? Why did you instigate those people to report me and take me to court? If I lose the lawsuit, I could very well be ruined and even go to jail. Now I've only used some of the same tactics, and you can't handle it.
Fine. You just wait. This Susan doesn't give me any chance at all.
Bad news, Mr. Howard.
What now?
Ark Pharmaceuticals is holding a press conference saying they want to terminate their partnership with us.
What? Ark Pharmaceuticals. They've worked with us for so many years. Why would they suddenly terminate the partnership?
It seems that when Susan sold the formula to Ark Pharmaceuticals back then, it was one of her conditions.
Damn it! It's Susan again. She really doesn't leave me any way out.
Mr. Howard, our stock has hit its lower limit again.
Quickly call Leon and the others. Give them some money and tell them to cause trouble for Susan.
Yes, sir.
Give us our money back! Give us our money back! Pay back! Pay back!
We took Susan's drug. That's why we're having these problems. She has to take responsibility today.
Exactly. That's right. Today, if we don't see her, we're not leaving, right? We're not leaving. We're not leaving. Make Susan come out and see us.
Come out! Susan doesn't dare to come out and see us. It's because she has a guilty conscience. It's precisely because we took her drug that we're suffering so much. Come out!
Susan, come out and pay us back. Come out.
Come out! Here she come out!
She's here.
You say you took my drug and became critically ill. Then show me the evidence.
Evidence. Evidence, I have it. Look, this is Susan's drug. I took this drug, and then my condition worsened.
This drug box is indeed mine, but the drug inside is not my drug.
What? How can you say that's not your drug? The packaging of this drug is your packaging, isn't it?
I just smelled it. There's one ingredient missing, raspberry. If you don't believe me, get it tested.
No need to test it, right?
So you admit this isn't my drug anymore?
I admit it, but this is a counterfeit of your drug, so you also have a responsibility.
What are you talking about? How can you have the nerve to say such a thing? It's not like I asked Howard to counterfeit this drug. He was blinded by greed, and it's you who were also blinded by greed. Now you're turning around and blaming me. Don't you think that's ridiculous?
Huh? You knew this drug was bad all along, yet you still let us take it. That's truly malicious intent.
I'm sorry. Before, in front of the reporters, I already warned you all, but you didn't listen. And now you're coming back to me. Don't you think that's ridiculous? Ark Pharmaceuticals drug will be on the market today. You should hurry and buy Ark Pharmaceuticals drug to take. Excuse me. Ark Pharmaceuticals anti-cancer number 1 is already on the market. It's priced at 30,000 per bottle.
What? That expensive. 30,000. How can we afford that? Even if we lose everything.
It's only enough for 1 year.
The drug we bought from you before was 3,000.
Now that you realize that before I sold it for 3,000. But weren't you complaining it was too expensive and accused me of selling fake drug? And sued me?
Dr. Susan, this was all their idea. It has nothing to do with me, Dr. Susan. I beg you, save me. Please sell me some cheaper drug, okay?
What are you saying? Didn't you say HQ Pharmaceuticals would give us cheap drug? That's why we sued Susan, right?
Yes.
What are you talking about now?
Dr. Susan, back then we were all misled by Leon and HQ Pharmaceuticals. Please save us. Sell us the medicine, okay?
Didn't you say the drug I sold was fake, and that it was because you took my drug that you became critically ill? How dare I sell it to you then?
It's my fault, Dr. Susan. Howard and his people gave us money to say those things.
Dr. Susan, we are already critically ill. We need money. We were just being used.
Dr. Susan, please continue selling us the drug. You don't want to see us go to our deaths, right?
Sorry. As for the patent for this drug, I've already sold to Ark Pharmaceuticals. If you want to buy drug, you'll have to go to Ark Pharmaceuticals. I have no right to sell it.
Dr. Susan, could you please talk to Ark Pharmaceuticals and ask them to lower the price of the drug? Even $5,000 per box would be fine.
Ark Pharmaceuticals is a global pharmaceutical company. I have no right to interfere with their pricing. By the way, let me remind you, Howard knew the medicine had problems but still had you test it. Your current situation was all caused by him. Instead of crowding around here, you'd be better off going to HQ Pharmaceuticals and checking it out. If you can prove that you took HQ Pharmaceuticals' drug and that caused your problems, you can still seek compensation from them.
What? Let's hurry back.
We've reached this point all because of Howard.
Exactly.
We must get compensation.
Let's go. Let's go find him. Find him.
What are you doing?
Can you accept an interview, Mr. Howard? Can you accept my interview? Knowing full well that the drug had problems, you still let patients continue taking it? May I ask, was it to maintain the company's stock price? I heard the lab has already analyzed the drug and found its ingredients to be problematic, yet you still let patients continue taking it. How do you respond to this rumor? Mr. Howard, you want to protect HQ Pharmaceuticals' stock price and then cash out at a high price and leave. Are you planning to abscond with the money and flee abroad?
Nonsense! It's absolute nonsense! How could I possibly do such a thing? If we had known in advance that the drug had problems, then we would definitely have stopped its use immediately. It's impossible to continue the trials. Regarding these online rumors, I will find a way to clarify them. I hope everyone will believe me. Where is everyone?
Why is it locked?
It's locked.
There's no one here, right?
No one, what's going on? We trusted you so much, yet you poisoned us.
Howard, don't be a coward, damn it! If you don't come out, we're coming in!
This HQ Pharmaceuticals is truly despicable. They knew the drug had problems, but still intentionally made people test it. This is going to cost lives.
These people don't deserve any sympathy, but that's beside the point. If these drugs had passed clinical trials, who knows how many lives would have been lost.
Look quickly! Someone's going to jump!
Someone is jumping.
What?
Howard, you damn well ruined me. You owe me my life.
Stop putting on a show if you dare! Jump, jump!
Jump, and I'll call you a real man. Jump. Stop talking. Don't let him jump. If he jumps, who will we get compensation from then?
Exactly, Mr. Howard. Don't jump. Howard, you can't jump. Think about your family. Right? Better to live a dog's life than die a hero's. Right.
Ms. Susan, regarding Howard's death after jumping from the building, what are your thoughts?
If you ask me for my opinion, I can only say, good deeds are rewarded, evil deeds are punished. It's not that they won't be repaid, it's just that the time hasn't come yet.
Howard's death is directly related to your exposure. Do you feel guilty?
Do you want the honest truth? Actually, I don't feel guilty at all. In fact, I even feel a little thrilled.
Susan, you drove Howard to his death, then you have to compensate us.
I compensate you.
What would I compensate you for?
We could have easily gotten compensation from Howard. It's all because you caused his death, so you should compensate us.
What a joke! First of all, Howard's death was entirely his own doing and has absolutely nothing to do with me. Secondly,
You people,
also have nothing to do with me.
how can you talk like that? But we are all patients, you know.
Patients should be resting at home and resting properly instead of coming here every day to cause trouble for me.
Miss Susan, I've always respected you. Now you've achieved great success and are incredibly wealthy. You should be doing more good deeds. If it weren't for them volunteering for drug trials back then, how would you have your current billions? Now they are standing right here with their ill body. You shouldn't just leave them to suffer like this.
First of all, when I developed this medicine back then, selling it to them for $3,000 was already saving their lives. But instead, they sued me. Do I still owe them for that? Secondly, my medicine before it was released was already successfully developed. There were no issues at all.
Miss Susan, you earned 10 billion by selling the prescription. Later, you shorted the stock of HQ Group and earned another 10 billion. You now have a fortune of 20 billion, a true magnate. It shouldn't be hard for you to take out a few tens of millions to help them, right?
Oh. I see you're using a quality phone. And that bag is expensive. Your salary must be quite high. You probably have a car and a house, too. How about this, then? You sell your house and raise money to treat their illnesses. Since you're so kind, you surely won't refuse.
How can this be? If I sell my house, where will I live? I only have one house. Why am I forced to sell my house?
What's the big deal? If you sell the house, just rent one. You're so kind, yet you refuse to help them. Instead, you're asking me, isn't that a double standard? How about this? If you're willing to sell your house to pay for their medical treatment, then I'd also be willing to help them. That's fair, right?
Hey, why are you all looking at me? I can't help you. I have no money.
Miss, I am already bankrupt and I don't have much time left. I don't want to die. Please help me.
If you sell your house, then Dr. Susan will treat us. Then we won't die. In my next life, I'll work tirelessly to repay you. I will repay you.
Let go! Miss, you're so rich and your income is so high. Please help us. If you sell your house, we'll be saved.
Yes.
You wouldn't be so heartless as to not save our lives, would you? Let go! Hey, let go!
Don't come any closer. I won't sell my house. I want to help you, but I don't have money. This house is also something I worked so hard for and earned the money to buy.
All right. Today's interview ends here. If you don't leave, I'll call the police.
Miss, please help us.
Didn't I say the interview was already over?
Miss Susan, I represent MTV, and I hope you can participate in our show.
My apologies, I'm not interested.
Susan, we were thinking recently there have been too many rumors about you. If you could participate in our show, we could use MTV's influence to debunk the rumors.
That works. Then I'll reluctantly agree.
Autopsy results show that the person who jumped to their death from the rooftop at HQ Pharmaceuticals was not Howard, but a regular employee of HQ Pharmaceuticals who previously bought a large amount of the company's stock, leading to bankruptcy and thus jumped. Howard is currently still missing. However, he is also on the police's wanted list for selling harmful drugs. Tips from concerned citizens are welcome.
Hello, who is this?
Susan, you've ruined me.
Howard.
Susan, my company is bankrupt now. The police are still hunting for me. I'm telling you, I won't let this go. If you won't let me live, then I won't let you live either.
Was that Howard?
Yes.
He's wanted by the police. How dare he still threaten you? Are you in danger?
That works out. If he shows his face, the police can catch him faster. I just worry he won't appear. You don't need to worry about this. I'll contact the police. I'm just afraid we might scare him away.
This is Susan. This is really her car.
This car, it's over 30 million.
Susan, you're so rich now. Why don't you help us?
You're so rich. Why are you just watching us die? Our lives, are they not even worth as much as your car?
First of all, this is my money. How I spend it is my freedom. It's none of your business. Also, I'll point you in the right direction. Go buy Ark Pharma's authentic medicine, 30,000 a box. Don't trust that swindler Howard anymore. Now only the authentic medicine can save your lives. Alright, my time is almost up. I'm leaving now.
Welcome everyone to our show. Today our program will interview a pharmaceutical industry's rising star. She's very young, just graduated from college, and has already developed a world-class anti-cancer drug. A series of recent events has pushed her into the spotlight of public opinion. Let's welcome Miss Susan. Hello, Miss Susan. Today's interview will be quite relaxed. We'll mainly be collecting some questions from the internet, as well as having audience members ask questions live. Does that sound all right to you?
No problem.
Miss Susan, may I ask, what motivated you to develop this drug?
My motivation for developing this drug is very simple. It's my duty as a doctor, in 5 words, to heal and save lives.
When did you begin your medical career and why?
Because of my father. He was a great hero. He was a military doctor and even earned a second-class merit. However, after he retired, he worked on a ship to support the family, which ruined his health. He eventually got cancer and passed away. This is also my original intention for developing this drug.
Miss Susan, we all know that you were sued by patients. May I ask, do you regret developing this new drug?
I developed this drug to cure diseases and save lives. I have never regretted it. I only regret not seeing their true colors sooner. If I had known earlier what kind of people they were, I would never have sold the medicine to them.
Miss Susan, we've all heard your story, and we also know about you and the whistleblowers. Actually, I think their reporting you wasn't entirely wrong. After all, you initially didn't obtain administrative approval, and it was indeed an illegal, unauthorized drug. Then why can't you forgive them? You can spend hundreds of millions on luxury cars and mansions. Are you really unwilling to spare a little to save them? In your eyes, are these living human lives worth less than cars or houses?
Human lives are certainly precious. You could say human lives are priceless. But in my eyes, they aren't even human. Someone who can sue their own lifesaver and drag them to court, can they even be considered human? If they only did it because they doubted the efficacy of my medicine and sued me, then of course I could understand. But they were purely bribed by Howard. It was to buy Howard's cheap medicine that they sued me. Now Howard's medicine is unavailable, and my medicine is no longer sold, so they can only go buy from Ark Pharmaceuticals, the medicine that costs $30,000 per bottle. Isn't this just their own doing? Also, the more I look at you, the more familiar you seem. Aren't you Maris's daughter? Now that I've exposed you, you have nothing to say. Just because you are Maris's daughter, now that I'm not helping them,
You'll have to pay
for Maris's treatment. No wonder you're so anxious.
So she's Maris's daughter. No wonder she's so proactive.
Even coming to morally blackmail Susan. If she hadn't been discovered, people would have thought she was an emissary of justice.
Whether I'm someone's daughter or not is not important. I'm just speaking from the perspective of objective facts. Your medicine is indeed very expensive. It costs $3,000 per bottle. That's a sky-high price that many families cannot afford. So them looking for cheaper medicine is completely understandable.
No problem. You think my medicine is expensive, huh? Fine then. I won't sell it anymore. Are you satisfied? No problem at all. You think my medicine is too expensive, huh? Fine then. I won't sell it. Are you satisfied?
Miss Susan, what you're saying is extremely selfish. Your medicine is expensive, but that doesn't mean they don't need it. They need your medicine to save their lives. How can you refuse to sell it? Besides, they reported you. They had no other choice. They already know they made a mistake and they're begging for your forgiveness. Why do you have to hold on to it? Why can't you be a bit more generous?
I'm sorry I was wrong. I didn't mean to do it just now. Can you forgive me?
Susan, you're done for! I'm definitely going to sue you for intentional assault. You've seriously harmed me. Get ready to go to jail.
Well, that's where you're wrong. Didn't you just say one should be magnanimous? I only slapped you once. And just now, I already apologized.
Why do you have to
be so unforgiving and want me to go to jail? That's not very magnanimous of you.
You!
Oh, are you a hypocrite? You can only tell others to be magnanimous, but you yourself are vengeful. It's just a small slap. It won't break any bones. Why be so petty?
Susan's slap was brilliant.
Right. This woman is a hypocrite, so Susan slapped her to get back at her. That's why she slapped her. Now let's see what she has to say.
Susan, you just wait!
Miss Susan, why did you sell the formula? Why didn't you develop it yourself?
Given my situation at the time, I didn't have the capability to develop this formula, so I had no choice but to sell it. Moreover, I needed funds at that time to research new drugs.
Even if you had to sell the formula, I think you should have collaborated with pharmaceutical companies in Great Xia. Such an important formula, you shouldn't have partnered with foreign pharmaceutical companies. This was originally a major opportunity to strengthen our country's pharmaceutical industry, but you squandered it for nothing. You gained benefits, but the nation's interests were harmed. Developing new drugs is probably just your excuse, isn't it?
Exactly. Susan collaborating with foreign pharmaceutical companies was indeed a very wrong step.
Great Xia has so many pharmaceutical companies, yet she chose to cooperate with a foreign enterprise. This shows malicious intent.
What a pity. What a pity if only this anti-cancer drug could have stayed in Great Xia. How great would that be?
About this matter, everyone has really misunderstood me. The reason I sold the formula is because I have an even better formula.
What an even better formula? Anti-cancer number 1 is already a groundbreaking anti-cancer drug. Are you saying you have an even better formula than that? You're not trying to fool me, are you?
Since you're asking then, I'll take this opportunity today to announce this major news publicly. My newly developed drug that can treat lung cancer. The new miracle drug, anti-cancer number 2, has been successfully developed. Its effect will be even better than number 1 and is expected to completely eradicate lung cancer.
Susan is truly a genius developing a new drug so quickly. She's practically the top person in Great Xia medicine. I'd call her a medicine god.
We just misunderstood Susan, so it turns out she sold the anti-cancer number 1 because she had a better anti-cancer number 2.
Then may I ask, this drug, how will you price it? Will it be like Ark Pharmaceuticals pricing the drug at an exorbitant price?
Regarding the pricing of this formula, it is currently in a confidential stage. Please forgive me for not being able to announce it yet.
Oh no, she probably wants to price the drug at a high price.
She was so disregarding patients' lives and so indifferent, I'm sure the drug's price won't be low.
Even if it's priced high, it's still better than selling it to foreigners.
All right. Time's almost up. Today's interview ends here. Many thanks to Ms. Susan for being a guest and answering our questions. See you next time.
Susan. You've really messed me up. My company is bankrupt now. I'm also deeply in debt. What's more, I'm also on the police's most wanted list. I'm now a universally hated outcast. Are you satisfied now? Are you happy now?
What does that have to do with me? You brought this entirely upon yourself.
Bullshit! If it weren't for you, how could I have ended up in this predicament today? You knew all along that my medicine had problems, didn't you? And what's more, you even spent a fortune shorting my company. My misery, it's all because of you.
I did indeed know that your medicine had problems, but I already told the reporter face-to-face that counts as indirectly telling you. If you didn't listen, can you blame me?
You're just being unreasonable. Even if my medicine had problems, if you hadn't exposed it immediately, I could have covered it up. If you hadn't spent a fortune shorting my company, how could I have been wanted by the police? How could I have gone bankrupt? Why on earth did you do this?
Why did I do this? I should be asking you why back then did you have those people report me?
So if I hadn't had them report you back then, would the outcome have been different?
Howard, I have a question for you. Tell me, is money more important to me? Or are you more important to me?
It's me. Could it be money? No, that's not right. It's me.
Wrong. Getting rid of you is very important to me.
You!
But I actually want to thank you. If it weren't for you and those people reporting me, I wouldn't have sold the prescription at a high price, and wouldn't be where I am today.
All right. As your benefactor, can you get me 200 million so I can escape?
Do you think that's possible?
I'm not negotiating with you. Hurry, transfer the money to me.
Even if I give you the money now, you won't be able to take it. Currently, police nationwide are hunting you.
That's none of your business. I've already contacted an island nation. Once I get the money, I'm going there.
I'm afraid you won't be able to leave.
What do you mean?
Come out!
Howard, you are surrounded. Drop your weapons immediately and surrender. Don't make any more futile resistance.
Put the gun down, otherwise I'll shoot.
Don't listen to him. If you dare, shoot.
Don't think I won't shoot.
Howard, are you now thinking you have the upper hand?
What do you mean? Go! This is impossible.
I forgot to tell you. Besides developing new medicines, I also practiced some martial arts.
I lost completely.
Behave, let's go!
What important news is there today?
Xavier news came from Great Shia. Susan has already developed anti-cancer number 2. It said that it's better than our number 1, with better anti-cancer effects.
What? She developed a new drug again? How is this possible in such a short time?
The news was revealed by her on MTV during an interview. Absolutely true.
It seems the news is true. In front of a national audience. She wouldn't talk nonsense. She really is a genius. Calling her a medicine god wouldn't be an exaggeration.
It seems the global pharmaceutical industry is about to change dramatically.
But her new drug really has such a powerful effect. Then the one we have, the anti-cancer number 1 prescription, will become a piece of scrap paper.
She must have already had the formula for anti-cancer number 2. That's why she sold us anti-cancer number 1.
Is there any other important news?
Susan tomorrow morning will hold a press conference to announce the specific product and price of the new drug.
Prepare the plane immediately. I'm going to Great Shia. At all costs. I must get the formula for anti-cancer number 2.
This new drug, how much will she sell it for?
Dr. Susan, please save us.
Dr. Susan! It's all our fault. We shouldn't have reported you.
Dr. Susan, please be magnanimous. Give us another chance. Please help us. We really don't want to die.
Dr. Susan! Dr. Susan! It was all Howard who forced us. He wanted to steal your prescription. We were all forced.
Do you truly realize your mistakes?
Yes.
I'm not so sure about that. You just want to get my forgiveness and then get my help. As for what you said about Howard forcing you, that's even more nonsense. Did Howard hold a gun to your heads? It's entirely because you were just greedy for petty gains. I helped you for a year, selling you medicine at cost. But Howard only gave you a promise of free medicine. And you turned your guns against your benefactor. Are you even human?
All right, the press conference is about to officially begin. Those not involved, please stop speaking.
After a month of research and development, my new drug anti-cancer number 2 is finally about to be launched. This drug is developed from anti-cancer number 1 and has been optimized. Its effectiveness will be better than anti-cancer number 1. In clinical trials, it has been able to completely kill cancer cells. Cancer is about to be completely eradicated.
This is unbelievable! Dr. Susan!
Is this medicine really that miraculous? Is there any exaggeration involved?
Absolutely no exaggeration, and it has already passed human trials.
Will it be like the generic drugs from HQ Pharmaceuticals and have side effects?
Firstly, my drug is an original research drug, not a generic drug. Secondly, there will absolutely be no toxic side effects.
Dr. Susan, for this medicine, what price are you setting?
The price for this medicine is...
Hold on.
Isn't that Ark Pharma Xavier? Why is he here?
He's not here to buy the formula, is he? After all, once this medicine is launched, it will impact their anti-cancer number 1.
Is there something I can help you with, Mr. Xavier?
Then I'll get straight to the point. I want to buy your anti-cancer medicine formula. Name your price.
Sorry. The formula for this medicine I don't plan to sell.
10 billion.
Huh? No.
20 billion.
No.
50 billion.
No.
Final offer 100 billion.
I said no.
Then how much do you want?
The price for this medicine is still its cost price, 3,000.
3,000?
And what's more, it has been included in national medical insurance, which can reduce the cost by 50%. In other words, to purchase this medicine, you only need 1,500.
Miss Susan, it's fine if you don't sell the medicine to me, but you've set the price so low. Isn't that just throwing money away?
Because I have never forgotten my sacred duty as a doctor, which is to heal the wounded, rescue the dying, and save lives.
All right. Bravo.